Well, hello, everyone. I am really excited. I know I say this every time, but I'm very excited about this episode. And let me tell you something, you should be too, because what we're about to talk about is this amazing new service. I'm still wrapping my head around it. I have Alice and Dr. Lama Sibai here with me. I'll introduce them here in a second. But this new program, if you are a caregiver or you are newly diagnosed with dementia, or your family is supporting you, or you're a professional that works with individuals, this is some great news that we are about to explore. So I've invited Dr. Lama Sibai, who is a clinical neuropsychologist, and she specializes in the diagnosis and care of individuals with dementias and movement disorders. So thank you so much for coming, Dr. Lama. And Alice, tell me your full name. Oh, Allen-Redfern, it's right on their screen. Alice is a licensed clinical social worker, and she specializes in older adults, caregiving, and palliative care. And they both co-founded Magnolia. And maybe you can give us just a quick little snippet about what Magnolia is and where it's located. And just for the folks that are listening, I'm sure they're curious about that.
Yeah. Okay. So, yes, Alice and I, along with others, co-founded Magnolia after seeing that there's a tremendous need out here to support family caregivers. Oftentimes, we in healthcare are so hyper-focused on the person living with the condition, and we really lose sight of the fact that the people at home, the people in your neighborhood, the people that are your support systems are the ones that we really need to instill confidence in so that everyone benefits and everyone's health and quality of life can be preserved. So Magnolia is a team of clinicians, different types of disciplines that all have some expertise and specialty in the aging population and those living with chronic conditions like dementia. And, we provide wraparound services. We see ourselves as an extension of your already existing care. So we come in and we fill the gaps that traditional healthcare systems would struggle to put into place. So we build care guides and follow families on this journey, providing practical support and emotional support. There's so much that comes with these diagnoses, and it doesn't just impact the person living with the condition, but it has sort of a ripple effect that spreads. And so we want to be there and make sure that people don't feel like they're alone in this. Alice, do you want to add anything to that?
Yeah, I think that pretty much sums up Magnolia. I think, just practically, we're both, Dr. Sibai and I are based in Seattle, Washington, and that's where Magnolia are based right now in Washington. And then we're also opening our doors in August in California as well. And this support, I just want to also reiterate is, if folks are living in the US in those states, that's something that we can also, is covered by insurance as well. I think that's an important piece because up until around 2 years ago, we could not have done that. And so I think just sort of developments that have happened under kind of the previous administration allowed us to provide this kind of wraparound caregiver support using insurance, which I'm sure we'll talk a bit more about today. But yeah.
Fantastic. Oh my gosh. We were just talking before we hit the record button, just how much it means to me to meet people like the two of you who are so passionate about this work. And, years ago, there was so little attention given to the plight of people living with dementia, let alone their families and their support systems. And I love what you talked about with your philosophy of Magnolia, which is a philosophy that I share very much too, is that the importance of shifting some of the focus onto the caregiver, because there's more and more information about dementia and about how to support people that are living with that disease, and people that are the family members are often forgotten, and they don't have the knowledge or the tools. Nobody plans for this stuff. So it's just amazing to meet the both of you and to know that you're offering these services. So, with that said, I'm so excited today because we're going to talk about the guide program. And I don't know very much about this at all. I attended, Alice, you had a little informational meeting last month or so for professionals to learn more about this. I was blown away. I haven't been following it. So I had to have you come on, both of you, and kind of talk about this program. And so maybe we can start. Let's go ahead and start and set the stage a little bit about what do the two of you see people experience typically if they're new to this diagnosis, if they're new to the medical systems, if they're new to just which everybody is at one point. Nobody comes into this journey with a PhD and how to navigate the world of supporting yourself and others with dementia. And so what do you see the biggest challenges are? And then that'll kind of set the stage to this whole new program that we're going to talk about.
Yeah, thank you for that question, Laura. I think right now our traditional healthcare system, right, in the US is certainly failing families, I would say. I think at best, right, a family might receive a diagnosis, right, if there is a provider in their area that can provide that. So at best, that could be something that people can navigate and get. But then often after that, I just feel like people are often dropped into this maze, right, with no map or understanding of where to turn. And there might be a very resourceful person or patient or caregiver that can go online and see what's out there, but it's kind of on their shoulders to figure out where to turn. And I think there's a lot of confusion, right, about what kind of doctor to be in your healthcare team, how to plan for the future, where to get support. And I just don't think the system as it stands is kind of designed for that ongoing progressive disorders like dementia. And I think it's pretty good at focusing on like episodic, like acute care, but often when there's these complex medical, emotional, logistical coordination needs, there's just nothing there. So I also think another barrier is just that fragmentation as well, right? Services aren't coordinated. They might have a neurologist over here and a urologist over here and a PCP, and no one's talking to each other. And, I also just think the emotional toll and the financial stress and the stigma, like cultural stigma around memory loss, I think it can feel very overwhelming and isolated. And I think it's not just about access to care. It's about that kind of access to guidance that's really needed. And I'll just say, Dr. Sibai I'll let you speak to this, Dr. Sibai, but the reason that Magnolia was started might be a good also foundation to this question as well.
Thank you. Yeah. I mean, the other thing I would say is an interesting barrier is just how we think about aging and the lack of conversation about aging and what to expect. I think we are so hyper focused on anti-aging, especially as women, and that really creates a barrier to just step one of recognizing something might be off. I don't know if it's consistent with normal aging. What does normal aging look like? We don't talk about preventative measures that people can take to maintain good brain health. And so I see that a lot too. And it really makes it hard to even if you know where to go to get a diagnosis, it makes it really challenging just to bring you in to get that diagnosis. And the stigma and the sort of way that if it's discussed, if these neurodegenerative processes are discussed in the public, they're discussed in a way that really is just so negative, and it doesn't really leave room for hope, and that's just not an appropriate or honest way to have that conversation. And as Alice was mentioning, I shortly after fellowship and taking a job at a hospital here in the neurology department, I just felt like it's kind of odd that, especially neurology, we become kind of a diagnostic service. Maybe at best we can manage symptoms with some medications, but the reality is we're offering diagnoses that change people's lives and change the lives of those supporting them. So And that fragmentation that Alice was mentioning doesn't just exist in the healthcare system, but exists in between healthcare and community support. And that is absolutely, those two things are absolutely needed in order for anybody to really succeed on this journey. So that's a program that Alice was alluding to. I started a program in the neurology department there. That was the first of its kind, brought on the Alzheimer's Association and other community-based organizations that had the same vision and passion, but weren't able to access the people that they were here to support. So we kind of, built a bridge between the healthcare system and the community-based organizations to fill the gaps and get people what they actually needed. But you can see, as Alice described, there's just barriers at every step of this journey. Aside from getting the diagnosis, and then let's say you do get it, where do you turn? What questions do you ask? People don't know what they don't know. Not one expert in this field knows it all either. I have my limitations. I have to lean on Alice and bring her knowledge in. And between the two of us and our other clinical staff, then we can provide a really wraparound, holistic approach for folks.
Oh my gosh. Everything you've said. Oh my gosh, really. So many people, I've had past interviews with a neurologist and family caregivers and the clients I've met with over the years. And you speak so eloquently about that disjointedness of, on the most micro level, people they're grieving and they're lost and they're confused and they're paralyzed often. And to what you said, they don't know what they don't know. They know this is something serious and big, but they don't know where to turn or where to start. And many people they think of their doctor, they think of their neurologist, and many people have had experiences. I like that you kind of called that out a little bit, your own experience, your surprise that, wow, this is such an important part of a human being's life. And they're walking out with a diagnosis, and then what? And yeah, this is just beautiful.
And not everybody has the privilege of going to school for 1,000,000 years and getting this knowledge. And I strongly believe that those of us who are on this side of things, it's our duty to be out there and informing the community like what they need to know and guiding them through that process. And I am critical of our healthcare system. I am critical of my colleagues because we should be doing better and we should be doing more. And that's what Alice and I are doing here.
I love it. Oh, well done. Well done. So let's pivot and talk about this, because this new program, this guide program, it's brand new. I believe it's in the pilot stage, right? Okay. And I'm not going to say much because I don't know very much about it. But yeah, can you just start by explaining what this program is, and then we'll dive in, because this is so important for families.
Absolutely. Yeah, I'm happy to kind of start it with the caveat, like, I think we're all trying to wrap our heads around it, right? So, in terms of kind of where to start, I'll kind of speak to, yes, as you said, Laura, it is brand new. It basically came out, there was an application process. So this is a program. GUIDE stands for Guiding an Improved Dementia Experience. It is coming out of the Centers for Medicare and Medicaid. It was announced at the end of 2023, and basically the Centers for Medicare and Medicaid announced this new program that had 3 goals. One was to improve the quality of life for people living with dementia, reduce strain on unpaid family caregivers, and enable individuals to remain in their homes and their communities. And we kind of, this email landed in Dr. Sibai and I's, inbox, and we were like, wait, we had already kind of launched Magnolia and we were doing this. And now suddenly there was, more than anything, I think just a national recognition that things needed to change. And we just like paused and was like, okay, how do we get into this program? Like, what do we need to do? So there was a lengthy application process. So this is a national program. It is available across the US. However, it's not just as simple as going into your primary care and saying, hey, this is a Medicare benefit. Like clinicians and clinics had to apply, and we had to prove a lot. We had to prove our dementia proficiency. We had to prove that we had the staff to support it. We had to prove, there was a number of sort of eligibility criteria, and it was a lengthy process, but I think over 300 clinics applied across the US to get into this program and were accepted. And so, basically it's a Medicare benefit. Someone said to me, it's kind of like thinking around it like the hospice benefit, right? Like that if you need it and you have Medicare, you can access it. Think of Guide like that. It is a Medicare benefit that if you need it, you can access it. So the support that's available is fully covered by Medicare if you have Medicare Part A and B. It is, as you say, it's an 8-year pilot project. So it launched this year, and what we're feeling the pressure of is that, okay, we have to basically prove that this works. And we know that it does, but we have 8 years to collect that data and prove that, yes, this kind of wraparound support is the things that families need. And then hopefully after that, the program can continue. So what is it, right? Like, what do people get if you are eligible? And I can speak a little bit more about the eligibility criteria, but in terms of kind of what you get is basically that extra layer of healthcare. So you are assigned a nurse practitioner who can go over your medications, reconciliation, just understand clinically where you are in the journey.
Can I ask you a question just to clarify?
Yeah.
So who is the patient in this program?
Yeah, so the patient is the person living with memory loss.
Okay.
So that is the patient. However, the model of care really also focuses on the family caregiver too. So although the patient is the person living with the diagnosis, it really ensures that the family caregiver is also provided with that support.
Right. Okay.
So essentially there's like 9 pillars that kind of covers the Guide program. It's that comprehensive assessment piece. So really understanding and identifying, where are you in this journey? What do you do? What is it that you're dealing with? Then creating a care plan. So for both the patient and the family caregiver. So these are all the things that we make sure that our Guide families get. So a care plan, they have 24/7 access to a member of their care team, ongoing monitoring and support. So like we know, right, things change month to month, week to week, day to day. So what we love about this program is Guide ensures that you get that monthly check-in to ensure that you feel supported, but also like there's that preventative piece there too, right? So if like there's caregiver stress that we identify, if there's, new symptoms that we have to kind of address and make sure people can respond well to. So it's that ongoing monitoring and support of both the patient and the family caregiver as well. There's connection to community. So Guide really emphasizes and supports that idea that dementia support can't just happen within those like clinic walls, right? Like there has to be that connection between community and clinic. So, it really encourages sort of referral and coordination of community-based support as well. And the caregiver support really just is interwoven between all of these pillars, but one of them is training. So access to caregiver training around the different aspects of dementia so people can feel confident on this journey, right? And that kind of really combats that piece that we talked about at the beginning where people are left to navigate this on their own, right? No one comes along and teaches you how to do this, but this program really enforces like caregivers are doing the work, they need the training. So that's something that we have to provide to our Guide clients. Another piece is also respite. So they've recognized, right, that piece, I know, around like people need to be able to take a break. And so, eligible families can access up to $2,500 in this program to spend on in-home and out-of-home respite, which when we read that, it's kind of unheard of that a Medicare benefit passes down dollar amounts. Like that to me was such an innovative piece to this that was exciting. It comes with, barriers as you can imagine, but that really was just a recognition.
This is the beginning. Yeah, this is the beginning. So
exactly. Yeah. And then, yeah, the medication piece, and then just the care coordination and transition too. So that's kind of, if someone is having to move to long-term care or thinking about transitioning, really supporting and making sure that they feel supported in that. So, and that's another big pillar that they called out that families need to have on this journey. So those are kind of the 9 pillars of what Guide includes. And as I say, all of those pillars are covered by Medicare. There is no cost to access that support.
This is amazing.
And yeah.
So I have so many questions. I'm biting my tongue.
Okay, ask away.
Yeah, we go back and forth for sure. Okay, so one question that I have, I mean, I know that everybody listening is dying to hear the answer to, is how do you find these places? We are so fortunate in Washington State that you were approved, that if you live in Washington State, you can contact Magnolia Center. Is that right?
Mhm.
And so because we have individuals listening from all over, how do they find these places? I also know that we have a lot of professionals that listen and want to use this as a resource and learn more about it. And so maybe you can tell us how to find places that have been approved. And is there a difference between because sorry, my brain is like kicking off here. I have an idea of who you are with Magnolia and what your experience is. I'm wondering about these other places that were approved. Do they look similar to you? My guess is they have to offer the same services. Do you see that looking different around the country? Yeah, jump in.
Yeah, I mean, they don't all look the same. However, because the pillars that Alice outlined, right, we all have to find a way to have those criteria. And so I think one beautiful thing about this program is it does make clinics and hospitals in these traditional sort of medical settings, it forces them to interact with the community-based organizations that are there to provide this support, because there isn't a single clinic out there that can meet all of these criterias, and that's not an expectation. However, it is an expectation that if you don't, you find the organizations around you that do, and you partner together. And that includes the respite piece, who is going to take these Medicare dollars and who is going to provide the caregivers inside the homes. So it can look a little different, but when you sort of come down to the bottom line, you're going to get the same kind of services.
I got you. Yeah.
And then in terms of kind of where to find, right, the best website to go to is the CMS, the Center for Medicare and Medicaid Guide website. And we can share that. But to be honest, if you just Google CMS Guide program, it will come up. And there's actually a really cool interactive map that shows all the guide participants. So you'll see us on there, and then, all the different organizations. So that's a really great way for professionals and patients and caregivers to access it.
I'll make sure that I put that link in the show notes for people, but fantastic. So you said there were roughly around 300, give or take. I won't hold you to that.
Yeah.
But are you, and I could go look this up later. I'm just curious, did it look like every state was represented, or, and you may not know the answer to that. I'm just curious.
If anyone does, it's Alice.
Yeah, I know. I was reading, yes, and don't hold me to this, but I was reading an AARP article around Guide the other day, and they had mentioned that I think it was like Alaska and Arkansas. There's no representation in those 2 states. But again, check the website. But that kind of shocked me because I hadn't seen that there were states that had just, I
was curious. Yeah. Okay. Another question. So you said that this program comes with, did you say a nurse practitioner or?
Well, it's one of the requirements that your clinical staff have a nurse practitioner there.
Okay.
I think this program really highlights how different disciplines are needed in order to really help families on this journey. And so the nurse practitioner plays a certain kind of role, and the care navigators play a certain kind of role, and your doctor plays a certain kind of role. And so, I think as long as you have one on staff.
Yeah.
So what I want to, again, I'm thinking of questions that other people and myself have. my guess is this program is not meant to replace any of your medical providers, but more to work in lieu with them. And I was thinking that was a great example of just sort of comparing it, and I know that may not be fair across the board, but to hospice, that you have a team that's supporting. So my question is, I think a big area that people struggle with is when caregivers are trying to advocate for themselves around medication changes, medication, should they even consider medication for their loved one, to help with certain challenges or behaviors or things that come up. And what does that look like in this program? Is that team act as an advocate to someone's primary care? Are they able to prescribe in this team setting, or are they more communicating with their primary care team?
I think a little bit of both. I think wherever the guidance come from, it should come from the person who understands that some medications are not suitable for people living with this condition. I think that's where the biggest mistakes come up. Just because you have prescribing privileges doesn't always mean that you know what the appropriate medications are. And so I do think that, and we encourage families all the time. We talk about these medications, even if we're not the ones prescribing them per se. I'm explaining to folks what these medications can and cannot do, letting them know, hey, if you show up at the ER for any reason, do not let them, prescribe you a benzodiazepine. Do not let, these are not good medications. In fact, they can really hinder somebody's care. And so, yeah, I think in some instances, it might be the nurse practitioner on the team. In other instances, we are closing the loop on that conversation, going back to your primary care. And if sometimes primary care will say, this is sort of out of my scope. Do you have some suggestions? And that's the most honest and best way to have this conversation. We don't expect everybody to know everything, and that's unreal, but we have to speak up and say that. And this is why training families is also so vital, so that they can advocate and they can, ask, why are you giving me this medication? What should I expect from it? Is it a good idea for somebody living with memory loss, and so on and so forth?
Fantastic.
And I'll just add that to that too. Guide actually makes it a requirement that we're talking to all of these specialists, and they all have a copy of the care plan that we create, which I love, right? I just think that kind of really combats that fragmentation of care. And I think I can see often the relief that patients and families have that say, I am going to communicate with the people that you've told me and allowed me to communicate with, so we're all on the same page. So I just think Guide has really done a lot of, the team behind creating this program has done a lot of research into what families need, and that's one for sure. So
I love this. I love this so much because people are intelligent. We have to assume, and this is just an area that they aren't expected to know. But I love this collaborative approach because families want to advocate. They want to be informed, and they just, they're already experiencing high levels of stress. Again, the grief and loss they're living with every day. And they're trying to pull themselves together and be the best advocate they can be. But with lack of education, everybody needs a team. And so this is just that opportunity.
And people look to us as experts. We look at families as experts. You are the experts in what you are dealing with day in and day out. I cannot do my job if, one, I don't create a safe space for you and your family to come till you can be vulnerable enough to tell me the symptoms. We can only help with the information that we are given from experts. I see our families as the experts, and we just have the privilege of coming in and, filling in the gaps and providing that education and that guidance. But I think something important about this model of care is recognizing the family as, actually, you are an expert, and this is a collaborative thing. You don't just go to your doctor and just do what they say. I don't recommend that for anybody, to be quite honest with you. We are human beings, and we should be questioned. And if something isn't making sense, ask, and if you're not getting what you need, find another provider. We live in a place where we have the freedom to choose who's on our care team.
Oh, thank you for saying that too. What was my other question that I have? There's so many. I was thinking about, most individuals, their desire is to remain at home as long as possible, or their loved ones. That is their desire, is that they want to have their loved one remain home as long as possible. And I'm just thinking about even this family that I met with yesterday, who two sisters that walked through the journey with their father, who passed away with cancer, which is a very different type of caregiving experience. And they're now caring for their mother and helping hold the space for them, honoring, I guess what I'm seeing here in this program, and really to what you just spoke about, Dr. Sibai, is this change from coming into an appointment, listening to a doctor tell you what to do, leaving, and then floundering, trying to figure things out. As this example that I'm sharing, is that this is a family who feels so strongly about keeping their mom at home, and they don't know, they have no idea what the future is going to hold. We know what her diagnosis is. It's a particular type of dementia that is likely to progress quickly, and the psychological impact on them and the meaning that they have placed on, that it's an act of their love for their parent, that they would keep their loved one at home, and not maybe understanding that sometimes things can happen that might lead them, in a different direction later on. All of that to say, it's apparent to me how a team like yours, a team like a model that's set up with your guide program, that people will be able to talk about these things with the different team members that you have on board. And I want to ask, what are those team members? You may have just hit on that, Alice. I'm sorry, but I know nurse practitioner was one, and case manager. I don't know if you said case manager or clinical social worker. But I'll finish what I was saying, and then I want to hear about the team. But I guess what I'm saying is following the journey through, from the beginning stages where people have an idea of what they want, and then mid stages, things can change, later stages, things can change, but just not having a model that is so rigid that people are expected to jump through these hoops or this timeline in a certain way, but to meet people where they're at. Mm-hmm. So it sounds like this program really supports that piece of, if you want to age at home, if you're able to support yourself, with putting a team together, then that's fantastic. If you are not able to, that's okay too. Like, whatever is going on, it sounds like the guide program can meet you where you're at.
Definitely. I think that's also a part of the model that we love, is that I know it's an 8-year pilot project, but hopefully it will go on past that. But a big part of the model of care just in general at Magnolia is that ongoing continuation of support, right? We know things change, and just hearing that family, there are no small decisions, right, on this. So just to have someone to kind of walk through that with you is so important, right? There's so many complicated emotions. There's a lot of things that come up when there is illness in the family, right? It's a part of the family. So it's just kind of, how can we use that therapeutic alliance that they have with the team to just kind of help families through that and have them be prepared. I think that's a huge piece, is we're here to kind of plan for A, B, and C so that there isn't a crisis, and it's that kind of preventative support that people need. And, I think in terms of how we've been very intentional when we've hired our clinical team, in terms of trying to really fill the different gaps that people need. So we have an ARMP, we have kind of a medical director that oversees that clinical care. We have neuropsychologists that can do that diagnostic piece and capacity evaluation. We have our wonderful, we call them care navigators, but it's that case management piece that can do that kind of practical, ongoing, check in, how are you doing? And then we've got our clinical social workers and psychotherapists that can really provide that emotional support, because that is just such a necessary piece. And therapists that understand what it is to be diagnosed with a serious illness, what it is to care for someone and watch someone change over time, and what that means. Because I think that's a huge death and support, especially here in Washington, is finding kind of specialists in this area. And have I missed anybody else, Dr. Sibai?
No, I think you've captured everyone on the team. I think
Now, is this team, is that that's across the board for the guide program, or is this Magnolia?
no, this is Magnolia's team.
Okay, I just want to clarify.
Yeah, the
guide
guide
map-
requirements is at least a dementia proficient clinician, which could be an ARNP or a medical director, and then a care navigator. That's what it needs to include. So yeah, that's a really good differentiation. And then we just have all the other disciplines, but for guide, you just need those two.
And Alice said we were intentional how we hired folks and how we built our clinical team, because although guide is new and exciting, the reality is that Alice and I have been practicing a model of care like this for almost a decade. So we know we kind of have this, like, I don't know, privilege of knowing that you might need a little bit more, right? I think we focus so much on sort of the medical pieces and the health pieces. And one really, really important thing that isn't discussed enough, even within these conversations, is the emotional toll that it takes on families, the role changes that people go through, the identity changes that people go through, the dynamics that maybe were tucked away neatly at one point that are now surfacing, the trauma, sort of, it can create space for that stuff to surface, and it needs to be dealt with, and it needs to be addressed, and it needs to be supported. So that's why we made sure to have, psychotherapists on our team that really understand that aspect of the journey and provide that care. And that's been so helpful, and not just helping caregivers feel confident in their role, but also in reducing caregiver burnout, which is sort of this other pandemic, I like to call, that's in the background that again, we're not discussing enough, but caregiver burnout is huge. It is yet another thing that, whether you care about a human life or not, just if you want to look at from an institutional level, it's another financial burden that we could be looking at, because caregiver burden impacts not just your psychological well-being, but your physical well-being a lot. So we start to see caregivers getting sicker than the ones that they are supporting. So yeah.
Yeah, no, and it's so, again, I'm so excited that this program exists. And to both of your point, it's calling it out on a national level. If, the program may not be perfect, but, it's getting figured out, but the fact that it's being called out is huge. And the fact that this isn't just about supporting the person with dementia, this is about supporting the caregivers. Yeah.
And I would say too, we always want to honor a family's and respect a family's requests. When families come to us, I think the vast majority of people do want to keep their loved one in the home. And we want to honor that. And we also want to have an honest conversation of what that might look like. Yeah. And so that's, I don't put that on the family. That's not up to them to really look at the full scope of things. We have those hard conversations with folks. We tell them, I hear what you're saying, and here's what you might see in terms of needs and how they can increase. Do you think you can take that on? What do you think you need to take that on, so that we can start planning for that? And as Alice said, making sure that there's a plan B or C, but flexibility is really important on this journey. Just like, I kind of think about, for those of us who've had children, right? What does our doctor tell us? Like, do not come in with like a rigid birth plan, because things can happen and we need to be flexible. So we try to also work on that flexibility too.
I also really like the fact also that Guide can continue as a program if the person living with dementia moves into long-term care. I think that's a really important piece, because I think with a background in kind of community-based organizing, a lot of sort of state and federal sort of programs disqualify folks who move into like assisted living. And so the fact that part of the eligibility criteria, and I think part of Guide the model recognizes that even when that move happens, your caregiving role certainly does not stop. And those pillars continue to be a support to you. I just think that that was a really great decision on their part. And I'll just clarify that if someone does move into a long-term nursing home specifically, that disqualifies people for guide. But like memory care, assisted living, adult family home, it can continue even when that sort of transition happens, which I think is very necessary.
Amazing. So if somebody is already living in one of those settings, so they're already in an adult family home or a memory care facility, can the family apply for guide at that point? Oh, so
Yeah.
So fantastic. Okay.
Yeah.
So not
Yeah,
only does it follow them, it can meet them there as well.
Exactly. Yeah. And I'll just give you an example. I'm supporting a family who is enrolled in guide, and her husband is in an adult family home, and she is actually using the respite benefit, that $2,500 for extra companionship. And I just thought that was, and I told her about the benefit, and, in my mind, I was like, well, he's in an adult family home, but she was like, no, he needs to talk.
He needs the extra support.
And so we're spending that money. So just as an example of how it helped that family. Yeah.
That's amazing.
Yeah.
Oh my gosh, this information is so needed, and I want to thank you both so much for sharing about this. I know there's 100 more questions that people might have. Is it possible, if people do have questions about this program, and Alice, I don't want to blow up your email or phone or anything, but Dr. Sibai already said, if anybody knows, it's Alice.
Yeah, I mean, I'm happy to support that. So I don't want to just like throw you, go for it, Alice. You got this. But I more just wanted to highlight that because this is such a new program. Like we are so fortunate that Alice has really, she's like in it and understands it to the best that any clinician out here can. So yeah, we're fortunate to have her. But I am here to answer your question.
Thank you.
We'll share both of our emails.
Yeah, you can have both.
Oh, I love it. Now I so appreciate both of you. And I could see maybe having you back on in a few months to see how things are going and the new questions. I get a lot of questions from our listeners, and I might put together a list of those things that we can cover on a different episode.
We can dive into even more, like, what the diagnosis, behavioral, but whatever you think your listeners want to hear. Yeah. I think Alice and I are just so excited to be able to talk about these things and to have these ongoing conversations with people like you who know that this really matters.
Yeah, absolutely. Well, thank you both. And I'll be sharing all of your contact information with our listeners. And you just really, really appreciate that the two of you had the vision and the forethought and I can imagine what the approval process that was like. So thank you for going through that on behalf of, so many people that are going to benefit from this. So
thank you so much.
Thank you, Laura.